So today is day number 6 post-lump, and I decided today that I would just work from home and not have to spend the extra time in getting up and getting dressed and trying to get more comfortable with having my regular work routine here, so that way when I'm post-surgery or chemo days that I don't feel 100%, that I can still be productive at home in a work environment. So anyway, that's why I'm not have hair and makeup and all that good stuff on today. But anyway, yesterday was really better than I had expected. The hardest part really yesterday was the fasting part for me, is not having coffee in the morning and not having food to fuel my body. I felt super tired and very lethargic all day yesterday. Even when I was able to eat afternoon. So the PET scan was in the morning at Missouri Cancer Associates, and the girls did a fabulous job of getting me in and explaining everything that was going to happen for the day. But the reason really that Dr. Velick had ordered the PET scan was to really take a closer look at the lump that is underneath my arm to make sure that it is not cancerous, regardless of whatever the pathology report comes back as. So just extra cautionary step in the process, and that certainly changes the treatment plan a lot, knowing one or the other. They were able to read the scan immediately, which again, I found out is unusual, so that we send over the scans apparently to Boone Hospital Center and they have somebody read it immediately. So literally right after my PET scan, I was able to have an appointment with Dr. Velick and Gay quickly afterwards to take a look at what the scans were showing. And again, not a lot of bright spot on that. The little, I guess, scan showed that there was just a little bit of activity underneath my lymph node, but that certainly could be because of the biopsy that was performed last week and still it being a little swollen from that. So we still really don't know a lot. However, it's just one step in the process as I'm learning. And then shortly after the appointment for my scan was my meeting with Dr. Supis at Columbia Surgical Associates, and she was just fantastic. So she was very thorough. I love that she drew pictures of the duct in the breast and saying that I had invasive, not aggressive, but invasive ductal breast cancer, and explained the staging to me. Of course, stage 1, stage 2, somewhere in between there as of now, unless that we see that the lymph node is cancerous, and then of course that changes. The secondary part of putting the pieces of the puzzle together are finding out more of the report, and hopefully we should have some more information back on that today or tomorrow, so I'll keep you updated. But she was great about going over just different options that we would have, and really the forefront tends to be chemotherapy to reduce the lump size, and then a lumpectomy to actually remove that. So we're hoping that's what the case is, and that's I want to go as simple and easy as possible. So that's kind of my plan of action, as of knowing all of the information that was presented to me yesterday. I did learn that I have an inverted chest bone, which I always wondered why. I was on the spinning bike at Wilson's and I'm like gasping for air, and everybody around me is like, I got this, and I'm like, why am I the one breathing so hard? Well, the reason why is I do have an inverted chest bone, and she basically said you just won't be an Olympic athlete. So okay, great, and my heart is off-centered a little bit to allow for the inverted breastbone, so it's a little bit more over to the left, but basically, other than during heavy cardio, I have a hard time breathing, which I've noted for a really long time and had no idea why. That was a good tidbit of information that I learned about my body yesterday. So not that it makes any difference with anything else, it's just an FYI. After my appointment with Dr. Supis, then I went directly to see Jim Morris, and he was just fantastic. So he will definitely be somebody that I'm going to highlight as the marketing director for Missouri Cancer Associates for more people to know about his services. And you know, he was just so thorough and, you know, explaining different wigs. And, you know, the funny part about it is by the time that I got there, I was kind of over the hair for whatever reason. I guess maybe I've just had some time to kind of sit and think about, you know, it's just hair, you know, it grows back. That really treating the breast cancer is the most important thing in this process, and not the hair. So I'm kind of really past it. What I, you know, really looked at is just trying to find something that most resembles what I have, so that way I do have a wig in case I need to go out for a special occasion or whatever it is. I have an option. If I feel one day that I don't want to wear it, then I don't wear it. But I want to be able to have the options to be able to wear it if I do want to. So we ordered a wig and it will be here next Friday. So he is going to help me style. It's synthetic, so we went over, he did a very fabulous job of educating me on real hair versus synthetic and just the different options and lace front, and boy, I got a wig education yesterday. So very helpful, and I appreciate Jim taking the time to educate me and kind of go over what is the best fit for me. So anyway, the wig will be in next Friday, and sounds kind of funny, but I'm kind of excited to see it and put it on, and I'm just going to embrace it. You know, I think it's, you know, there's different ways of looking at this. And yesterday I actually told Dr. Velick in the appointment that we had is, you know, if I was going to get this diagnosis, I certainly wanted to make it count. So I don't really know exactly what that looks like. But, you know, I'm open to just whatever comes next and whatever I'm supposed to do. I'm here to do it. So anyway, that's where I am today. All right, thanks.